So, how my story was to become a peer specialist was when I had completed the PTSD program over there in Menlo Park. Um, I was asking around to do volunteer work, and this was back in 2011. At the time, there was no peer support work. There was no peer support in general, and so my dreams were a little crushed, because I wanted to take what I have learned and help others, help my fellow veterans to kind of understand what it is that, that can be done and what's possible, within the VA. I was just fortunate enough to pick up with a provider. Her name was Dr. Sheila Jane, and she was putting in um, she was putting together a project to work with peer support. She was actually funded by Stanford Medicine. Coincidentally, at the time that I was working with Dr. Sheila Jane, that's where Sony Adams and Jill Hudson were putting together peer support for Menlo Park. So in a sense, the road was being built. I was just on another track, and we were moving in the same directions, just not knowing that we were working together. It wasn't until about 2013 is when our paths started crossing, and that's when, after once our grant had came up, was up to being completed with Stanford, was when I was able to get hired full time through Palo Alto. Um, and so having those connections with Jill Hudson and Sony Adams, they just brought me along. And from the work that I have done out in the valley with the Stockton VA and Modesto VA, they just said, "Hey, continue what you're doing because you already have, you've already built the path, you've already built the structure, and you're established. So don't stop. Um, we just want you to work full time for us now." And that in itself was rewarding. That was kind of, you know, my approval, my validation of my work and my determination to kind of help get what it is that I wanted. Um, and so being able to do that and be a part of that, that was my reward. That was my personal pat on the back. And so from there, it just kind of just took the ball and just kept running with it.
Peer specialist is a very unique discipline. The VA rolled it out about 7, 8 years ago. And a peer specialist is a veteran, number one, far as with the VA or DOD, is a person who have that lived experience, a person who maybe suffer from a mental health diagnosis, a person who may have been impacted by certain conditions coming out the military that landed them in a correctional system. They could be a person who, is in recovery from substance abuse, or they just could be a person who been severely diagnosed with a medical condition, and those areas might have caused them some issues or problems in the past on their own. So basically, a peer support specialist is someone with that lived experience and who has transitioned from that and living in recovery and coming back to model and to affect and help other veterans transition through the VA system and being a part of helping them, navigate the VA and navigate some of the services that are offered by the VA. I've been a member of Vapor now for over 2 years, 2.5 years, and coming aboard Vapor kind of lend credit to the peer support component of what I do as a VA employee because again, it gives me that platform to sit down and be involved in research and be involved with trying to disseminate information from not only a veteran's perspective, but a veteran with a lived experience perspective who navigate the VA because again, the VA is my healthcare provider as well as my employer. So those two unique distinctions makes us somewhat different than the average VA employee or just the average person coming here for care because we wear both hats, so to speak. So that in and of itself has been very powerful to me because again, at the end of the day, one of my testimonies is when I'm busy, and when I'm busy in a constructive way, when my day, I wake up, I have this purpose of going out knowing I'm going to work, hopefully to have a positive change on a veteran, or maybe affect change on someone who's been affected or who went through what I went through. That is a very helpful recovery process for me. So actually, when I come out to work and come out to help and deal with other veterans, I'm really working and dealing with myself too. Because again, a peer specialist is someone who's living in recovery. So the day-to-day interaction of helping others is like a tool, it's like a remedy to keep us on track and to reinforce our recovery from day to day. So I think that's very powerful in and of itself.
We wanted to keep veterans at the center of our quality improvement program, Modeling to Learn. And part of the way we did that was from the very beginning forming the Vapor Board, Veterans Advisory Partnership for Operations and Research, to decide even what grants we would pursue and what projects, research projects and operations projects we would pursue to improve the quality of addiction and mental health care. So from the very beginning, we wanted this partnership-based approach where perhaps voices and perspectives that would be essential to improving the quality of care, meaning the closest firsthand lived experience of what addiction and mental health care is like. We wanted those voices at the table from the very beginning of deciding what research questions we would ask and what methods we would use to answer those questions. Originally, we were thinking that what we would do is co-facilitate the sessions with a certified peer support specialist and someone who is an expert in using simulation at the point of care to help frontline staff find improvements. So sort of like a systems expert, an engineering expert, and then somebody with this first-hand lived experience of using VA care. But nationally, the peer support program is sort of new. It's new state by state in the United States outside of VA, and the VA is really sort of a leader in getting the certified peer support specialty going. And so it was clear that when we were going to launch Modeling to Learn nationally at the scale of the largest addiction and mental health system in the United States, then we weren't going to have enough person power to have the Vapor Board in front of the room for every single frontline staff meeting that we do all around the country. And so we had to use media and technology to meet that value or that principle that we had of keeping their stories at the center of what we were doing. And so the plan B was that we would record them, Vapor Board members, telling their stories of the first time that they came into the VA to get care, which in VA jargon we call access to care. And what I mean by jargon is that we'll have all these initiatives focused on improving quality so that more veterans can get into care. And when you're a frontline staff person and you're tired and you're working really hard, hearing that there's going to be a new quality improvement initiative on access can sort of feel like just one more thing to manage. And when you hear the story of what a veteran went through that first day just to get through the door, just to show up on the VA campus, it reminds you of what a critical moment it is, that first day, that first visit to the VA. And it just, it reminds us of why we sit down to focus on quality improvement. And so we have Vapor stories about the first time they came to the VA all throughout Modeling to Learn. And then the second set of stories everyone told was about, once they were in VA care, what was that journey like? What were the ups and downs of trying to actually get connected with a treatment that worked or a program that worked? For sure, recovery is not easy. That's not a unique to VA problem. That's recovery. When you're struggling with PTSD, addiction, some of the other concerns that veterans might need help with, there's ups and downs. And so everybody was telling their stories of how did they stick with it, and what were the biggest fails that they encountered in the system, and what were the biggest successes. And so everybody has included those when we talk about the continuity of care that it takes in order for veterans to be able to get their needs met, to get what we might call a therapeutic course of treatment or services. And so that's the second set of vapor stories in Modeling to Learn. And then the third set is we realized that what was sort of maybe most surprising to a lot of people is that the VA changed the lives of these veterans so profoundly that they wanted to come back and be certified peer support specialists, and that they want to guide the VA's quality improvement efforts in addiction and mental health care. It's like really an amazingly inspiring story to see people ready to lead in stable recovery, trying to help other veterans and help the VA fulfill its mission. And so the last stories are, what the Vapor Board members know now that they're staff, and what messages that they have as staff to their colleagues in terms of what they hope they'll get out of Modeling to Learn, and why it's so important to keep a recovery and veteran-centered focus in our quality improvement efforts.
Yeah, so as a member of the Vapor Board, some of my input is valued and is sought out because I am a veteran with a lived experience to bring a different understanding that cannot be, read out of a book or manualized. It's a lived experience, and through me describing what they were for me, that's been really enlightening, and feels real valued that people want to know what my story is, so that I could kind of like help set up an idea to help out other veterans.
What is your hope in like sharing your story and working on these different programs? Like what do you hope maybe another veteran would get from it, or what is your goal with it?
So when I share my story, it's a twofold thing. One part was an unsuccessful story, when I was pretty resistant to treatment, and wouldn't allow someone with the expertise from a background, an academic background, provide treatment. The other side to my story is that once I let the guard down and kind of got out of my own way, I was able to be successful. So when I talk to other veterans and share my story, now that I'm 19 years clean and sober and still, managing some of my own mental health challenges, I'm able to provide, that if I can do it, they can do it, So, and it brings a hope and some kind of, level of motivation, when they see me in this capacity as a peer support specialist.
It's okay to talk. Let me show you by example what can happen. People say, well, what do you get out of being a peer support? Well, I lead by example, and what I do is I sell hope. But it's not pie in the sky stuff that you can't do. It's reality, okay? If I can do it, if the old dog here can do it, I got oftentimes my young veterans who are going through some very tough crisis times will come to me. How do I get to be part of this? How can I get a piece of what you're doing? And I tell them. I never lie to them. I just straight up talk to them about it. And for me, that's just a very meaningful experience. Does that answer your question? What brought me back to the VA was I had reached a point in my life where I basically was like a carton of milk that was past its use-by date. I felt like, all right, I'm such and such years old. I've done everything I need to. I've accomplished what I need to, and I really don't need to be here any longer. So a very serious suicide attempt is what it was, and I was taken to Stanford. Stanford Hospital surgeons worked on me, and the next morning the chief surgeon came to me and said, real miracle that you didn't really butcher yourself. And she says, I really want you to know that. And by the way, are you a veteran? And I said, yes, I am. And they said, okay. And then I went over to the acute psychiatric inpatient unit of the VA Palo Alto Hospital. Discovered rather quickly that as water seeks its own level, I partnered with 3 other people that were through similar situations. Some had drug problems, others had other issues. And, for me, it was an enlightening experience. I really hadn't felt supported like that in a long time. I mean, the staff was very supportive, but the veterans that were on the unit were very supportive of each other. And we followed through with each other from the time that we all came up with our own plans, and I reached a point where people were asking me about different programs, and I said, well, let's find out about it. I was there for a period of time. I went down to a program that they had available in our Menlo Park location. I arranged for housing. I arranged for the programs with the okay of the people in acute inpatient, and that's what I did. And from there, I was touch base with many of the people that I had left on the units that asked me about the programs. How they trusted me to come up with it. So I realized I had an ability to engage at that point. And I really, as I was going through the process of screwing my head back on right, and going through the programs, what I learned was that I had an ability to give it back, and I knew that deep inside I really wanted to do that one way or another. I just wanted to find that, and that's really what brought me through it. The fact that I can give back.
So prior to me transitioning to the VA, I was incarcerated, and unbeknownst to me, because it was years and years that had went by, I was totally devoid and disconnected from the VA. I met a gentleman who's an outreach specialist under the DOM program, and he comes into state prisons and county jails and, whole audience with veterans. He found out if veterans there, then, so anyway, this gentleman got us to form a veteran group in state prison, so he was able to come in and he started bringing information, he started bringing pamphlets, and he started, providing resources, things we can write before we got out, how to write to request your DD-214, et cetera, et cetera. And that was that had a very profound impact on me. And because like I said, prior to that, I wasn't even considering the VA. And the more knowledgeable I became about this new VA, the more, I took interest in it. So much so that I ended up paroling straight to a veterans homeless program here at Menlo Park, VA. And I think that was a turning point, because I had my doubts and skepticism, but people were saying, no, man, this is a great place to come to. And I did. And so that was my first introduction to the VA, was by way of the outreach specialist. And then paroling to a VA homeless program that had everything set up for successful transition, coming out of being a consumer at one point of the California Department of Corrections. So that in itself exposed me. I mean, things were set up. So it gave me a different outlook on the VA. Now I'm seeing the VA that, they provided me a therapist, they set me up with the business office, they contacted and got my medical records that I totally forgot about for many years, wasn't even thinking about medical records. They lined me and put me in place with comprehensive work therapy, CWT program, because they understood coming from because the VA have these measures in place that a lot of other healthcare providers, I don't even think of, would conceive of doing. So they knew if a person was locked up, a veteran, for a period of time, coming back out, transitioning back into community and society, it took certain steps. So they got a program called Comprehensive Work Therapy, 2-year program, and this program is solely designed to reintroduce you back into the workforce. And they knew you was going to have problems. I mean, and they had everything in place. This job wasn't to fire you because you didn't come in one day because you were stressing or something triggered you or whatever the case may be, because it understood all the parameters associated with a mental diagnosis. It understood the parameters associated with being incarcerated for a long time. So this was unique, and it wasn't like just I came out and somebody said, man, I can get you a job working over here. Well, you go get the job with them, but it's a regular job. Either you don't hold up and they're going to fire you and put somebody else. CWT was different. So the things I became exposed to at the VA was unlike prior to me. And it was like, wow, they really do have some measures in place to help a person transition off of drugs, transition, out of an institutional setting, transition from homelessness. So they have things in place that if you work with them and showed up every day, you can get to the next level of your life. So I thought that was very, very important, and it just gave me a whole different outlook on the VA, the services that helped me get to the level where I'm at today, where I'm a service provider, employee, and I'm out in the community, out in the field, offering assistance to get a veteran to the level that I'm at now, feeling comfortable with living independent, making good decisions, and just, being of quality state of mind.
When I got divorced in 2015, I lived on the streets of Sacramento for quite some time. And I had my dog with me, and one night I remember clearly, it was raining out. I had my dog. I had maybe one bag with me that I was pulling along, and it was so wet and so cold I didn't know where to go. So what I did is I went to the closest fire department, and I sat at the front door of the fire department until somebody found me and my dog. I laid there all night until morning time when one of the firefighters came out, and he told me I can't be laying down there in front of the fire department. I said, I got nowhere to go, man. It's me and my dog, we're both cold and all that. And then he goes, well, let me go talk to my captain. So he went in and talked to his captain, and maybe 10 minutes later he comes out with a plate of food and a couple blankets, right? And they asked if there's anywhere that they could take me or something like that. I go, I'm a veteran. Maybe they could do something. So they called the VA, and within maybe 2 hours, there was a VA rep there at the fire department picking me up and picking my dog up and getting me coordinated through going through treatment, getting me off the streets, right? That's when my recovery really happened. It started, and so they put me in a program, and it was a 90-day program, and I did very well. I completed it. I went to a sober living facility after that, but I relapsed after about 5 months of being out of the program. Being complacent, not really working a program of recovery. So what happened was I went back to the treatment center again, same one, for 90 days. I got out. The VA accompanied with me with a brand new apartment, and once again I couldn't do it. I kept relapsing, Finally, the VA, what they did is they sent me somewhere that they felt was going to work for me, and work with my trauma, and really work on my behaviors, and not so much just reading out of a book all the time. I get down to, I was actually on probation, and probation had took me down there to Menlo Park, and I walked in there, and I was I was really scared, anxious. I had a lot of anxiety. I was depressed. But then in the back of my head, I was excited, right? Because I'm sober. I'm going to get some more treatment. I'm going to get the therapy I need. I'm going to be able to work on my trauma. Prolonged exposure is where you record yourself every session. So you may be in a session for an hour and a half. You record that session. On the 2 days you have off from not seeing your psychologist, you go to your room and you, at nighttime or whatever, however long it takes, and you listen to that recording for however long that your psychologist encourages you to do. Throughout the process of the therapy, each session I had a different feeling, emotion, thought that came up. Because really what the whole point of it is to actually work the therapy by actually having 1 foot in the trauma and 1 foot out, right? Because you don't want to throw yourself all the way back in it. Something might happen. And I think after the second session, I was very angry. I think the third session I was confused. fourth session I was hurt, and so on, right? And I had a different emotion after each session. My psychologist was really adamant that I, in detail, talk about everything in the traumatic event that happened to me: smell, touch, feel, sight, you know. And that can be very hard where you're trying to place yourself back in the event that happened to you, which actually gave you some trauma. I mean, it's scary, right? I have PTSD, and I also have depression. And so it just got really scary for me. It really did. I was, to relive a traumatic event that I wanted to shield for the rest of my life, and that's what I use drugs and alcohol for, so I don't have to feel or think about it. It was scary. And like, as I'm talking about it right now, I'm reflecting like through the sessions that we went through, me and my psychologist, and how tough it was for me. You know, the event that happened to me was tough enough, and then to actually have to relive it was really hard for me. I did all the therapy. It was 12 to 14 weeks, I think it was. Every day, in and out, living it. And by the end of the sessions, I was relieved. I have no problem talking about it these days because I've talked through it so much that it's okay. You know what I mean? I use it for my other people's benefit these days. I really feel that my addiction and my trauma that's happened to me is beneficial for other individuals. Because a lot of people don't come out of their shell in the military, as in like letting somebody know that they were traumatized sexually, or, you know, or forcefully, and they hold it in. Embarrassment comes up, or they think, why didn't I stop it? Was it my fault? Because there's a lot of stuff that happens in the middle of that traumatic event that is unexplainable to me still, you know. A lot of it has to do with fear. And even if it's not military sexual trauma, if it's childhood sexual trauma, you know, adult sexual trauma, you know, it's not just the military that this stuff happens in. This is actually in society. And so I really believe that society could probably really get a big benefit from the VA by seeing how that they actually do the therapeutic process with individuals.
For me, it was a challenge. One, because the mere fact that I didn't feel I deserved any kind of treatment, because again, I came back whole. I came back with all my limbs. I didn't have any bullet holes. I was healthy. I was fine. That was my issue. And so I didn't have an understanding that there's more to the VA than what it really offers. I had to learn that while I was in the programs. After a number of years of participating with inpatient, outpatient programs, I learned that there's a lot more to the VA and to other treatments that can help a person mentally, physically, emotionally, and spiritually. Because for me, I was broken on more than just the physical part. And that I didn't understand. So the educational part, to know what it is that I had to deal with, understand what was going on with me mentally, emotionally, and spiritually, that was a big hit to my pride. And so really accepting and having to educate myself, those were the things that I had to learn. And that's what the VA was able to teach me.
I hope that if a veteran and his or her family or an active duty service member were to see this, that they would know that there are people at this cutting edge of science trying to come up with the most applied, practical things that we could possibly do to get them into care that is the highest quality care available meaning the absolute top of the medical research literature, research evidence base, and that we want to get them into that care without delay. Now, I don't want to present too rosy of a picture. Trying to cover every single veteran and service member everywhere is a challenging job, and I know there's variations in care for sure, and that's part of the challenge, is how someone can have absolutely state-of-the-art care at the top in one VA and struggle perhaps in another VA that may be struggling or understaffed or need other resources. But I think that what I have learned from talking to a lot of veterans is that a lot of times people have just heard bits and pieces in the media, or they've heard stories from someone who went to the VA decades ago, or they went one time. And the truth is, recovery after trauma, if you're struggling with PTSD or substance use disorders or other needs, if you're thinking about taking your life, these are things that you have to keep trying to get the help that you need, and you need to talk to people about it. And I think that a lot of veterans do find community in each other by coming into the VA. They find a respect and professionalism in training what military values and culture are from the staff. And you find absolute expertise in traumatic brain injury, PTSD, and a variety of the presenting concerns that we know are common among a variety of veterans who have served us, meaning served the United States. And so I think that if it could be normalized, that after the level of service and sacrifice that many service members provide, that you have earned these services, and that we are tireless in our attempts to make them better and better all the time, I would hope that that would give people hope to try again or reach out to somebody and not be afraid to come in and check it out for themselves and see if they might have the same kind of complete, transformative, empowering experience that you see among our VAPOR members, the certified peer support specialists. Again, it's totally inspiring to me that the VA has improve their lives so profoundly that they are just as dedicated as they were when they were in the service to the VA mission to provide the absolute top mental health and addiction care to our veterans. And so I hope that there is enough of that message getting out to veterans, because what I fear is that there's an irresponsibility in only presenting the negative side of things and not presenting enough of the stories of hope.
So at the end of the day, I ask the employees, the leadership, to think back on that, being a part of this during our challenging times, that we are a part of something that's having a positive and great impact on our veterans. And to the veterans, I would ask, don't believe all the hype. Don't believe these 1 minute blibs that media come out with on some VA didn't do this right or whatever. This is a bureaucracy, and it serves a lot of people. But at the end of the day, I would ask that you come in. You earn the right to be serviced by this healthcare provider, this system. Come in and take a look at it for yourself. Come in and see the value of being aligned with this healthcare and how it can actually improve or help you with the quality of life that you so deserve because you served. And I thank you all for serving, and I thank all the providers, stakeholder, and leadership who's a part of this. I thank you for providing your services, and let's continue to do what we do to have a positive impact on our veterans.
The message I would like to tell other veterans is go to the VA. Go and just ask for help. As simple as that may sound, that is the biggest challenge that any one of us can really do. It's a fear factor, because what it is, it's something that we weren't trained to do, and that's to be vulnerable. To be able to ask for help and know that we may think that we're alone in those type of feelings and those type of thought processes. We're not. There's so many more of us that are hurting and are needing help. And the only way that we can get help is if we ask for help. So when we go to the VA, just go to say, I am struggling. I need help. I don't know what I'm doing. I need a sense of direction. Those are important questions to ask. And in the VA, somebody there will be able to help us either answer the questions or direct us to certain people that can help us in those questions.